Question 1. A nurse is caring for a client post-lymph node biopsy. Which finding requires immediate intervention? A. Mild bruising around the biopsy site. B. Serous drainage from the incision. C. Sudden swelling and tightness in the affected limb. D. Slight discomfort during limb movement. Answer: C. Sudden swelling and tightness in the affected limb. Question 2. Which patient should the nurse assess first based on lymphatic system complications? A. A client with non-pitting edema in one arm following mastectomy. B. A client with mild fatigue and generalized lymphadenopathy. C. A client reporting new onset of unilateral leg swelling and tightness. D. A client with a history of lymphoma reporting night sweats. Answer: C. A client reporting new onset of unilateral leg swelling and tightness. Question 3. Which action is appropriate for the RN to delegate to a licensed practical nurse, LPN, regarding a patient with lymphedema? A. Perform manual lymphatic drainage. B. Assess for signs of infection in the affected limb. C. Educate the patient about lymphedema management. D. Apply prescribed compression bandages. Answer: D. Apply prescribed compression bandages. Question 4. A patient with Hodgkin's lymphoma reports fatigue and enlarged cervical lymph nodes. What is the nurse's priority action? A. Encourage activity and mobility. B. Schedule the next dose of chemotherapy. C. Assess respiratory function and airway patency. D. Offer supportive counseling. Answer: C. Assess respiratory function and airway patency. Question 5. Which lymphatic organ is responsible for the destruction of old red blood cells and immune response initiation? A. Thymus. B. Tonsils. C. Spleen. D. Lymph nodes. Answer: C. Spleen. Question 6. A nurse notes a patient with axillary lymph node dissection is wearing a tight wristwatch on the same arm. What is the most appropriate action? A. Remove the watch and explain the risk of lymphedema. B. Ask the patient to loosen the watch. C. Document and continue with care. D. Notify the provider immediately. Answer: A. Remove the watch and explain the risk of lymphedema. Question 7. In the lymphatic system, which component filters lymph and traps pathogens? A. Lymph capillaries. B. Lymph nodes. C. Lacteals. D. Cisterna. Answer: B. Lymph nodes. Question 8. Which statement by a UAP unlicensed assistive personnel indicates a need for further teaching about caring for a patient at risk for lymphedema? A. I'll remind the patient to elevate the arm. B. I can take the blood pressure on the affected arm. C. I'll encourage gentle arm exercises. D. I'll report any swelling in the fingers. Answer: B. I can take the blood pressure on the affected arm. Question 9. Which lymphatic organ is most active in children and shrinks with age? A. Thymus. B. Tonsils. C. Spleen. D. Peyer's patches. Answer: A. Thymus. Question 10. The nurse is assessing a patient with suspected lymphatic obstruction. Which clinical finding supports this diagnosis? A. Soft symmetrical edema that improves with elevation. B. Non-pitting edema and thickened skin. C. Dependent edema relieved by rest. D. Pitting edema with rapid onset. Answer: B. Non-pitting edema and thickened skin. Question 11. What is the primary function of the lymphatic system in relation to immunity? A. Absorption of dietary fats. B. Production of red blood cells. C. Transport of oxygenated blood. D. Filtration and transport of immune cells. Answer: D. Filtration and transport of immune cells. Question 12. A patient with severe lymphedema is scheduled for manual lymph drainage. Which member of the healthcare team should perform this intervention? A. Unlicensed assistive personnel. B. Licensed practical nurse. C. Physical therapist or certified lymphedema therapist. D. Registered nurse. Answer: C. Physical therapist or certified lymphedema therapist. Question 13. Which nursing intervention best prevents infection in a client with compromised lymphatic drainage? A. Apply ice to the affected limb. B. Elevate the limb continuously. C. Maintain meticulous skin hygiene. D. Restrict all limb movements. Answer: C. Maintain meticulous skin hygiene. Question 14. A patient reports a painless, enlarged lymph node in the neck. What is the most appropriate nursing action? A. Reassure the patient that this is likely benign. B. Monitor for changes over the next few weeks. C. Document and report for further evaluation. D. Encourage warm compresses. Answer: C. Document and report for further evaluation. Question 15. Which of the following is a major lymphatic duct that drains lymph into the venous system? A. Celiac duct. B. Thoracic duct. C. Bile duct. D. Renal duct. Answer: B. Thoracic duct. Question 16. A patient post-mastectomy is at risk for lymphedema. Which action should the nurse teach to minimize risk? A. Keep the arm immobile. B. Avoid use of compression garments. C. Perform daily gentle arm exercises. D. Elevate the arm only at night. Answer: C. Perform daily gentle arm exercises. Question 17. In lymphatic system anatomy, lacteals primarily function to: A. Transport white blood cells. B. Absorb dietary fats in the small intestine. C. Regulate blood volume. D. Produce lymphocytes. Answer: B. Absorb dietary fats in the small intestine. Question 18. Which patient assignment would be most appropriate for a UAP under RN supervision? A. Educating a patient about preventing lymphedema. B. Performing a focused lymphatic assessment. C. Assisting a patient with applying a compression sleeve. D. Documenting the progression of lymph node enlargement. Answer: C. Assisting a patient with applying a compression sleeve. Question 19. Which clinical manifestation is expected with a blocked lymphatic vessel? A. Localized heat and erythema. B. Painless pitting edema. C. Non-pitting progressive swelling. D. Cool pale extremities. Answer: C. Non-pitting progressive swelling. Question 20. A patient receiving chemotherapy develops neutropenia and reports swollen groin lymph nodes. What is the nurse's priority action? A. Educate the patient about neutropenic precautions. B. Assess for signs of systemic infection. C. Encourage oral hydration. D. Reassure the patient this is a common side effect. Answer: B. Assess for signs of systemic infection. Question 21. A nurse is caring for a client with lymphedema of the right arm. Which intervention is most appropriate? A. Administer 4 fluids through the right arm. B. Monitor blood pressure using the left arm. C. Apply warm compresses to the swollen arm. D. Encourage tight bandaging of the affected arm. Answer: B. Monitor blood pressure using the left arm. Question 22. A patient presents with bilateral swollen inguinal lymph nodes and fever. Which findings should the nurse report immediately? A. Complaints of fatigue. B. Difficulty urinating. C. Foul-smelling drainage from a leg wound. D. A temperature of 99 degrees Fahrenheit. Answer. C. Foul-smelling drainage from a leg wound. Question 23. Which of the following patients should the RN assess first after shift change? A. A patient with splenomegaly reporting left upper quadrant discomfort. B. A patient with a sore throat and palpable submandibular lymph nodes. C. A postoperative client with new onset of hard, tender axillary nodes. D. A patient with lymphedema following lymph node removal. Answer. C. A postoperative client with new onset of hard, tender axillary nodes. Question 24. What is the primary role of lymph in the lymphatic system? A. Deliver oxygen to cells. B. Remove waste from blood vessels. C. Transport proteins and immune cells. D. Control heart rate and rhythm. Answer. C. Transport proteins and immune cells. Question 25. Which lymphatic structure returns lymph to the right subclavian vein? A. Thoracic duct. B. Right lymphatic duct. C. Cisterna chyla. D. Left lymphatic duct. Answer. B. Right lymphatic duct. Question 26. A client has a splenectomy scheduled. Which teaching point is a priority? A. Avoid dairy for 24 hours post-op. B. You will need to monitor your blood sugar levels. C. You are at increased risk for infections. D. You must sleep on your right side after surgery. Answer. C. You are at increased risk for infections. Question 27. Which nursing action is most appropriate when caring for a client with impaired lymphatic drainage? A. Encourage prolonged standing. B. Restrict fluid intake to prevent swelling. C. Apply sequential compression devices. D. Elevate the affected extremity. Answer. D. Elevate the affected extremity. Question 28. A nurse is teaching a client with lymphedema. Which statement indicates effective understanding? A. I will apply ice packs daily to reduce swelling. B. I should avoid wearing gloves when gardening. C. I should avoid injections in the affected limb. D. I can use a heating pad to help with drainage. Answer. C. I should avoid injections in the affected limb. Question 29. Which condition is most likely to cause secondary lymphedema? A. Deep vein thrombosis. B. Congenital absence of lymph vessels. C. Lymph node removal due to cancer. D. Peripheral neuropathy. Answer. C. Lymph node removal due to cancer. Question 30. Which of the following is a characteristic function of the tonsils? A. Stimulate red blood cell production. B. Initiate immune response to inhaled pathogens. C. Filter cerebrospinal fluid. D. Balance sodium levels in the bloodstream. Answer. B. Initiate immune response to inhaled pathogens. Question 31. What is the best nursing action to prevent complications after axillary lymph node dissection? A. Place cold compresses on the incision site. B. Keep the arm below heart level at all times. C. Encourage early arm movement and exercise. D. Avoid elevating the arm during the first 48 hours. Answer. C. Encourage early arm movement and exercise. Question 32. A nurse receives handoff report. Which patient condition related to lymphatic dysfunction is most urgent? A. Non-pitting edema in lower limbs. B. Reported chills and tender, red lymph nodes. C. Painless cervical lymphadenopathy. D. Axillary lymphedema after mastectomy. Answer: B. Reported chills and tender, red lymph nodes. Question 33. The nurse is educating a patient about lymphatic circulation. Which fact is accurate? A. Lymphatic vessels carry blood away from tissues. B. Lymph circulation is powered by skeletal muscle contraction. C. Lymph fluid is oxygen-rich. D. Lymph returns to the arterial system directly. Answer: B. Lymph circulation is powered by skeletal muscle contraction. Question 34. In planning care for a client with left arm lymphedema, which task is best delegated to a UAP? A. Assess skin for signs of infection. B. Elevate the affected arm during bed repositioning. C. Educate the patient on compression sleeve use. D. Evaluate response to manual drainage therapy. Answer: B. Elevate the affected arm during bed repositioning. Question 35. Which change in the lymphatic system is commonly seen in older adults? A. Increased lymph node size. B. Faster immune response. C. Decreased production of lymphocytes. D. Enlargement of a thymus gland. Answer: C. Decreased production of lymphocytes. Question 36. The nurse is reviewing lab results. Which value supports impaired lymphatic immune function? A. Elevated hemoglobin. B. Decreased lymphocyte count. C. Increased platelet count. D. Low serum sodium. Answer: B. Decreased lymphocyte count. Question 37. A nurse notices that a patient has visible red streaks extending from a leg wound toward the groin. What is the priority action? A. Apply an antibiotic ointment. B. Document as normal lymph flow. C. Notify the healthcare provider immediately. D. Encourage the patient to ambulate. Answer: C. Notify the healthcare provider immediately. Question 38. A client asks why the lymphatic system is important. The nurse's best response is A. It helps regulate blood pressure. B. It transports oxygen and nutrients. C. It protects the body against infection. D. It absorbs carbohydrates from digestion. Answer: C. It protects the body against infection. Question 39. Which nursing action best demonstrates infection prevention in a patient with impaired lymphatic drainage? A. Administer antibiotics prophylactically. B. Monitor temperature weekly. C. Instruct patient to wear protective gloves when gardening. D. Apply lotion only after lymphatic massage. Answer: C. Instruct patient to wear protective gloves when gardening. Question 40. A patient is diagnosed with lymphangitis. What finding supports this diagnosis? A. Hard, painless lymph nodes. B. Red tender streaks following lymph channels. C. Generalized edema and fatigue. D. Non-tender swelling in groin. Answer: B. Red, tender streaks following lymph channels. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.